I'm Dr. Parker, and welcome to another episode of Holding Space. And I will be holding space for you during this time. Hopefully, you can hold space for me. I am going to be continuing the series on trauma. So, trigger warning, there are going to be some things that we talk about during the course of discussing trauma, some experiences that create trauma that may be difficult for some people to hear. We want to remind you to take care of yourself, and if something seems to be too much for you, by all means turn it off or practice some meditative or self-healing techniques to work along with the issues that we're talking about. Left unchecked, there's no aspect of health, well-being, or relationship that is unaffected by trauma. Our nervous system becomes alerted and stays on alert and set to high alert. And our brain development can be derailed if we're children. It can even be derailed some as we're adults because our brain's continually developing, along with disruptive physical and emotional reactions as our body and mind continue to defend us against a threat that may no longer be existing. It can be in the past, but it's still very much real. And it can still haunt us and frighten us in the present. Ultimately, it's not only what happened to us that matters, but also must be understood and honored, and also how we make sense of these experiences. So let's talk about a particular type of trauma. I said I was going to talk about the complex trauma that a lot of people experience. It usually begins in childhood. It's a form of dissociative trauma. We're going to talk about dissociative disorder again in the future, but when it comes to trauma, we're talking about a high severity of PTSD. There's a predominance of derealization and depersonalization. If you've never experienced these, you're fortunate. It usually comes along with anxiety, but you feel sometimes disconnected from your own body. Your body doesn't feel like your own. Sometimes people report feeling like everyone else is robots. Sometimes they report feeling like they're robots. Things just don't seem real anymore. The world around you doesn't seem real. Times you feel like you're in a daze or floating in a fog. Not medication induced, it's just, I don't know what's happening. People talk about brain fog with a variety of things, but this is a severe type of brain fog in which nothing seems to be making sense anymore. You may have trouble remembering details about a traumatic event or trouble remembering details about anything in particular. So these are some of the symptoms of PTSD, especially when it's associated with trauma. Trauma that is complex. It was added to the ICD in May of 2019, and it's in effect of January 2022. It's defined as repeated, chronic, and prolonged exposure to traumatic events. This is the type of trauma that doesn't happen just once. This is the sort of thing that becomes chronic. There is a sense of no exit. You get feelings of hopelessness, helplessness, powerlessness. And often there is a childhood onset, and it's interpersonal in nature. So we see it as a result of childhood abuse. We see it as a result of childhood neglect. We see it as a result of domestic violence, ongoing social stress such as bullying, community and political violence, refugee situations, prolonged captivity. Obviously, some of those latter ones are things that a lot of people are dealing with right now, and there may be a sense among a lot of young people that they are experiencing things that either that they hear about through the news or experiencing them directly. I've heard from a few kids who are experiencing trauma as a result of shooter drills that they experience in school. This is obviously something that would be traumatic to anybody, but it's particularly traumatic when you're a child. When you're a child, if you don't have a sense of what's going to happen next, if you could be visited by a traumatic event or even neglected or not have the future explained to you, you can develop a sense of uncertainty and unreality. It becomes something that is, well, we talk about fight or flight. It's actually a lot more complicated than that now. We're looking at fight, flight, freeze, or fawn. And fight obviously comes out as angry outbursts, controlling, bullying, narcissistic behavior. We can talk more about narcissism in the future, but in general, you kind of close in to protect yourself. And explosive behavior. Those are results of fight. Flight, escapism. You become a workaholic. You become an overthinker. Anxiety, panic, obsessive compulsive disorder, obsessive compulsive behavior, even if you don't have the disorder. Again, something we'll talk about in the future. Difficulty sitting still, a worsening of attention deficit symptoms. You can be a perfectionist, and that's a form of flight. By losing yourself in details, you can become lost away from the sense of trauma and upset. Freeze is difficulty decision making. You have difficulty deciding what to do. You have difficulty deciding where to go, who to relate to. You feel stuck. You can experience dissociation at this point. That's a form of freeze because you're not really with your environment anymore. You're isolated from it. You can become socially isolated. You can become interpersonally isolated from loved ones. You can have an experience of feeling numb, of just being totally outside of yourself. Fawn is one that has been added fairly recently, and it's really interesting to see this. We've talked about this in relation to hostage situations. We've talked about this in response to, if anybody remembers Petty Hearst, if anybody remembers Stockholm Syndrome. Those are dramatic examples, but you can become a people pleaser. You can have a lack of identity. You can lose your sense of boundaries and just basically cave into what anybody else wants from you. You can feel overwhelmed. You can feel codependent. So you lose yourself in taking care of somebody else, and they need you in order to take care of their needs. Codependency is also something we can talk about at some point in the future, but basically that is one of the responses to fawn. Fawning you often see in relationships in which someone is being abused or domestic violence situations. Oh, I'll do anything to make him happy. And people will even turn aside offers of help. People will turn aside police officers who come to the door because there's a disturbance. They want to protect the person who is abusing them. And this is something that comes as a result of repeated trauma. Again, this is one of those things that may be triggering to some people, but if you've experienced something like that, we will talk about that in the future. But for now, just understand that it's something that a lot of people experience in response to repeated trauma. You can, as a child, become so separated from adult reasoning that you are unable to process what's going on around you and you cannot get any answers. A lot of people who are taking care of their children do not take care of their mental well-being, and you experience such a separation that if only your parent could say, I know I'm really having a bad day right now. It's not your fault. Come here and let me give you a hug, but go play and let me take care of myself. How often do you think that actually happens? Really not very often. People become lost in their own world. They become lost in their own troubles. And when it comes to dealing with children, you need to be present. So if you're feeling dissociated, they call it fragmentation also. Staring into space for long periods of time. Difficulty remembering broad periods of life. You'll hear some people who are like, I don't remember anything that happened before I was 10. And sometimes that's a symptom of severe abuse. Sometimes it's just a symptom of not being able to track what happened because you were dissociated during a lot of that time. I worked with one young woman who, she says, I have the memory of a walnut, which is really an amusing way of saying she just can't keep track. She severely dissociates and she will lose track of what she's talking about in the middle of a sentence. You'll ask her, how did you feel when that happened? And she won't remember. You can ask, how did you feel 5 minutes ago? And she won't even necessarily remember. especially when it comes to feelings. People can dissociate themselves from their feelings really easily. And I've had people also come to me who said, I don't feel anything. I don't know what's going on. They become numb. But dissociation is generally something that can happen in any kind of overstimulating situation. I experienced it once when I walked into my son's high school. Hadn't been in a public school in a while, and they get to be pretty loud. And there were people in the hallways. There were people coming at me from all different directions, changing classes. There were people making noise, throwing things, generally being happy. But my brain just overloaded. And I felt that feeling of being disconnected from everything. It just felt like it was very far away. You see the thing in the movies where you're kind of like going into a tunnel and it seems to protract in front of you. It was very much that sort of feeling. Imagine feeling that way on a fairly consistent basis. It's pretty awful. You suddenly get tired. You feel far away. You feel as if you're looking at the world through a fog. You express that people or objects or the world feels unreal. You feel disconnected from your body or emotionally numb. You feel like there are different people in different situations, and you can be different in different situations. And frequently we will encounter this also. You may even do this from time to time. Sometimes you feel like, well, I can handle this better if I do it like this superhero, or I feel like I can handle this better. That's a conscious choice, and that's okay as long as you know what you're doing. It's when you suddenly feel like I'm not me anymore, maybe somebody else, don't know what's happening. That is a result sometimes of re-experiencing trauma. It's an aspect of PTSD. We discussed post-traumatic stress disorder last time. We can continue discussing it because it's going to pop up at various times in relation to various issues. And we will see that sometimes people are experiencing a memory full blown. Sometimes there's the absence of memory and just that separation from your sense of reality. You may feel, act, or talk like a younger person. I've seen this in people who have experienced the severe trauma at a young age, and they will, when recounting that trauma, begin talking like a small child. And, like, why are you doing baby talk? And they're doing baby talk because that was the last strong place they were at, or that's when they experienced that particular trauma. They are reliving it, and as they're recounting it, they are that small child again. It's a little bit frightening sometimes when it suddenly feels like you're in the room with a different person. It just manifests as a totally different person. You can arrive at places and you don't know how you got there. Now, everybody does that from time to time. We do automatic driving. There are times I set out going somewhere and I'm thinking, I've been told, don't think and drive at the same time. You can pay attention to what you're doing when you're driving, but if you're thinking about something else, it's like, oh, I'm headed for the office and I meant to go to the grocery store. But this is a different kind of separation. This is being so separated from where you're going and what you're doing that you arrive someplace and you have no idea how you got there. You can find things and you don't remember buying them. A really severe version of this is dissociative identity disorder, in which you assume the identity of someone else. There are also fugue states that people go into in which they can they're driven by, it seems, a separate motor. They get on a bus headed for Alaska and suddenly they wake up in Alaska and they have no idea how they got there. That's one long bus ride, but could actually happen. Those are the sorts of things that we talk about when we talk about separating from yourself. We also can talk about being able to find some sense of closure to these. And again, the therapy for these is usually post-traumatic stress work on something like EMDR, DBT, dialectical behavior therapy, cognitive behavior therapy. Again, we'll get more into different types of therapy, and I have a couple of people who are interested in talking about their experiences with trauma that hopefully we can get to next time. But in short, complex trauma is complex. It is not something that happens just once. Your response is not just once. And usually the trauma is interwoven with the fabric of your life to an extent that it's really difficult to tease out. If you have one thing that happened, it's pretty easy to remember there was this time that this bad thing happened. But something like being neglected by your parents, or not getting answers to questions, not getting any closure on how things work or why these people are doing the things that they're doing, can leave you with a sense of scanning. You're always waiting for the other shoe to drop. So you're constantly scanning the environment. You're in a constant state of looking at things and wondering what's going to happen next. So there's like a low level anxiety that's like creeping through your life, and then sometimes it can spike, but that comes as a result of having an uncertainty as to how the world works. It's it's a it's a frightening thing to behold, and it's a frightening thing to live with. Hidden aspects and hidden factors in the development of PTSD. These are kind of extreme examples, but pre-verbal trauma exists, pre-perinatal trauma. Things that happen as a result of being in utero with someone else who is traumatized send certain chemicals to the body. And babies can be born with a heightened sensitivity to stimulus. They can be born with a heightened sense of fear. They can be born with an easy startle response. All the things that come along with PTSD. It's sort of like a pre-manufactured PTSD. Epigenetics and transgenerational trauma you'll see talked about from time to time. This is unresolved PTSD in parents. It's not really necessarily magical and that it's genetically transferred. But if you think about it, someone who has lived a life that is traumatic, they have learned certain responses to being able to handle things. The whole fight, flight, freeze, and fawn. And it changes the way they experience life, and it's experienced by children as a different way of being. Your parents are not quite like anybody else's parents, and you don't understand why. And sometimes they seem more easily angered. Sometimes they seem like they're not present at all. It can be scary if you go up to your parents and try and work out a problem, or even just have a conversation and they're staring off into space. There is some evidence that there may be some genetic material that's transmitted that may make it more easy for you to be susceptible to trauma, but that's because, again, it's been induced in your parents. You can experience poor modeling of health promoting behaviors, smoking, drinking, poor nutrition, lack of exercise. If you grow up in that kind of environment, naturally you're going to pick that up too. And oftentimes we will see people who will say, oh, yeah, well, I'm overweight because my parents are overweight. Well, it's not necessarily genetic. It can be, but sometimes it's just that this is what's been modeled. The presence of a learning disability can be related to trauma. People who have experienced severe trauma early on miss critical phases of development, and a learning disability can be a result of that. Sometimes it's easy to recover once you know what's going on. One of my children actually was raised, her early part of her life was raised without any parental input, and she spent some time in an orphanage. She's adopted. Came to us really with no perception of how to handle certain things. She did not know how to brush her teeth. She did not know how to read. She had never been exposed to letters or numbers before. And she was 6 years old. And so picking up those things at that point was really difficult. A couple of teachers were saying, oh, well, she'll never learn. Of course she will. And of course she did. And she's very resourceful. She managed to find some ways of organizing her environment and feeling much better about things, because she went out and she said, take me to Staples. And she bought binders and markers and Post-it notes and tabs and organized her stuff so that she had an external hard drive. That's coping for you. But you can have social and cultural risk factors: oppression, discrimination, bullying, harassment, a lack of belonging. This is something that a lot of people are experiencing now, and I think it's topical and it's something that we need to be aware of. It's not just that we're treating certain adults a certain way, it's that this is also having an impact on future generations. You can create a generational trauma by the way a person is treated now. Lack of resilience factors. Resilience is another thing that we're going to do a whole episode on because it's so critical. But in general, resilience comes from believing that you can handle things. It comes from a sense of belonging. And usually the things that build resilience are giving a person a sense of competency, of caring, and of belonging to something. I think that's as much as we can do for now. We can come back to some of this stuff later. And like I said, there are certain disorders and things that are going to be mentioned that we can cover in future episodes. Please feel free to write in, and our address again is holding space. Well, it's Barker holding space at gmail.com. And give us some ideas for topics that you want to see, or if you would like to come and talk to us, you can do that. You can phone in and we can have a conversation about this. I'm here for you, and I'm very interested in your perspective on the things we say. I have been a psychologist for over 20 years. I don't know everything. And if you've lived this, you know more about it than I do. But we educate each other. That is holding space for today, and I appreciate your viewership, and I will see you next time. Thank you.